Hi, welcome to the ViaQuest Compliance Program Training. My name is Gabrielle Bryson, the Compliance Officer for ViaQuest, and today we're going to review some important key components of the ViaQuest Compliance Program. So first, we're going to start off on knowing who is responsible for compliance. And the answer is everyone. Everyone at ViaQuest is responsible for compliance, regardless of the position that you're in. You are part of the compliance program. If you didn't know, now you know. Being non-compliant affects everyone. Some quick examples could include costing the company money, damaging our ViaQuest reputation, our mission values, and even potentially, worst case scenario, cause legal issues that could prevent us providing the great services you do to the clients we serve, individuals we serve. The compliance officer is responsible for the operations and administration functions of the ViaQuest compliance program. And then ultimately, the board is responsible for overseeing our compliance program. The first thing that we're going to talk about today is compliance standards of conduct. Upon hire and annually, we are ensuring that everybody reviews the standards of conduct. So the next couple of slides I'm going to read to you, and I'm making sure that you understand the ViaQuest compliance standards of conduct to ensure that we are committed to legal and ethical behaviors. So the first one that we're going to talk about is maintaining high work performance standards. If you are unclear about your functions, please ask for clarifications or additional training. All management and supervisors in all business lines are willing and able to provide additional training and help you make sure that you're providing great services, whether if you're in administration or if you're directly working with our individuals. Have a mature, courteous, and helpful attitude. As we work with our client and as our second choice value has humor, we want to make sure, and integrity, and all of our choice values, but we want to make sure that we are providing services in a mature, courteous, and a helpful attitude in every aspect of our positions here. Number 3 is treat everyone with civility, honesty, and respect. Don't engage in discriminatory, harassing, retaliatory, inappropriate, illegal, or disruptive behaviors. So that goes back to our professionalism, making sure that, and our values, making sure that we're not doing any of those items listed there in number 3, making sure that we're always being respectful and honest is really important. Number 4, know and follow the letter and spirit of applicable laws, rules, regulations, and guidelines, as well as company policy procedures. If you're unclear of rules, laws, or policies, please always reach out to the compliance officer, to your supervisor, to HR, and ask for clarification and guidance. Number 5, think and act ethically and professionally. Consider how your words and actions reflect on the company's reputation with individuals, co-workers, referral sources, vendors, and the community. You represent ViaQuest as you provide services. Like I said, whether if you're in the administrative side or the client side, you need to ensure that you are acting ethically and responsible and professional, excuse me. Number 6, respect and protect the confidentiality of company business information and PHI, which stands for Protective Health Information, of our clients and individuals served by the company. Treat and protect the information the same way you would your own. Okay, so later in the training, we're going to talk more about PHI and protecting information and making sure that we are maintaining confidentiality all times as we're working. Number 7, don't accept or give gifts, favors, benefits, services, or items of value in return for treatment of services. Okay, ViaQuest pays you, the company pays you for the services that you're providing. Accepting gifts, favors, or benefits, or anything from the people that we're serving, we want to shy away from that. and we're going to talk about that a little later also. Maintain accurate, timely and complete records. Documentation and billing must accurately reflect the services provided. And so that's really important, making sure you're knowing the times, not rounding them, or ensuring that everything that you write, all the documentation you're writing, reflects the actual services we're providing. That's really important there. Number 9, don't use company resources or time for personal benefits to harm someone or for political or illegal activities. That one's pretty straightforward there. So making sure you're using company resources for items that is benefiting your work items there only. Number 10, avoid conflict of interest. Don't engage in activities or enter in contracts that interfere with or give the appearance of interfering with your work at the company or that affects your independent judgment. And we're going to get into conflict of interest a little bit later in the training. If there is any concerns of conflict of interest, please report that to the compliance officer, and we are going to address that. So those are the 10 standards of conduct. At the end of this training module, you acknowledge of being reviewing all our 10 standards of conduct. As I said in the beginning, we do this upon hire and annually. So this will be your annual training for the standards of conduct. Please reach out to your supervisor, HR, or the compliance officer if you have any questions of these 10 standards of conduct, and if you'd like additional information on how to ensure that you are being ethical and responsible regarding the standards of conduct. All right, so now let's get into the different components of our compliance program. Federal regulations state that every company has to have a compliance program. The first one is making sure that we are following policy procedures. ViaQuest has developed company-wide policy procedures that reflect our commitment to comply with all federal, state, and local laws, rules, and regulations. All employees are responsible for knowing and following these policy procedures. You can find all policy procedures day and night, anytime, by accessing your Paycor account. And it's going to be underneath your profile, and you'll be able to find them there. If you have issues with following policy or finding the policy procedures in Paycor, please reach out to your supervisor or reach out to HR. They should be able to guide you on how to find those policy procedures. The next component is education and training. This is what we're doing right now, doing an education and training component. What the training is going to detail and some of the things that we're going to talk about today is making sure that we are detecting and preventing fraud, waste, and abuse. We're going to talk about protecting the privacy of PHI or ePHI, electronic, and maintaining our compliance. Education and training allows you to be a key part of compliance. So making sure that you're aware what compliance is will help you be able to detect compliance issues and be able to report any concerns that you have. The next item is auditing and monitoring. The compliance program is always performing audits and monitoring to ensure and to reduce high-risk problems and prone functions. So that is making sure that we're billing correctly, making sure that we are keeping individual serves documentation private. We do exclusions and sanction screenings on everybody that provides services. And we review documentation, making sure that we're providing services that are meeting medical necessity standards. The next item is investigation and reporting. Please ensure that, and we're going to review this a little bit later, but we investigate any concerns that is brought up to the compliance program, and we want you guys to report any concerns. And so we monitor that, and we ensure that we investigate any issues that is brought up. Last but not least is promoting open lines of communication. Every ViaQuest employee has a duty to report compliance concerns without fear of retaliation. And ViaQuest does have a policy, and we really enforce to our management that retaliation is not acceptable. So please report any issues, and we will address them as they occur. All right, so let's get into some of these education items now. First, we're going to get into some definitions. The first one we're going to get into is fraud. Fraud is knowingly submitting or causing to be submitted false claims or misrepresenting facts to obtain federal health care plan payments. Knowingly soliciting, receiving, offering, or paying money to induce or reduce referrals for items or services reimbursed by federal healthcare programs. Making prohibited referrals for certain designated healthcare services. So example of this is knowingly billing for services or supplies that the individual service never actually received and that you did not document that. So please make sure that the services that we are giving and doing is being documented and it is actually what is needed there. The next one is waste. And that is overuse of services or other practices that directly or indirectly result in unnecessary costs to the healthcare systems, including the Medicare and Medicaid program. So an example for this one is charging excessively for services or supplies. So ordering more things that you need, or billing or providing more services than what's medically necessary for that client. The next one is abuse. Any practice that either directly or indirectly results in unnecessary costs of the Medicare program. Any practice inconsistent with providing individuals with medically necessary services, meeting professionally recognized standards. An example for this one is ordering or billing for unnecessary or excessive medical services or supplies. So kind of the same thing for that. Now let's talk about the anti-kickback statute. What that means is knowing and willingly offering, paying, soliciting, and receiving ramifications directly or indirectly to induce or reward referrals or of items for services reimbursable by the federal healthcare program. And so some examples of that is kickbacks in general, bribing, doing some type of rebates or gifting, providing above or low market rent, payments, discounts, those type of things like that. So an example is paying an incentive to a physician or to a provider to refer all of their clients to ViaQuest, to the company for services. And so that's what anti-kickback is about. Then we're going to get into the Stark Law, which means prohibits, the definition of this is prohibits a physician from referring certain designated health services, and I'll give a definition for that in a second, payable by Medicare and Medicaid to an entity which the physician or immediate family member has an ownership and or investment interest, or with which he or she has a compensation arrangement, unless an exception applies. So a designated healthcare service could include lab services, physical therapy, occupational therapy, speech therapy, pathology, all those different types of therapy, any type of medical or nutritional items or outpatient prescription drugs or anything like that, hospital services. So that really just covers a lot of broad health services in general. Example of a potential anti-Stark Law issue could be like a physician referring all his clients to physical therapy by a physical therapy company that's owned by his spouse or his or her spouse. And so anybody that has that connection to that person, whether it be a spouse or a child or a very close family member, we want to be mindful of not just referring to help family members out, but providing referrals to all the physical therapy in the area. So now that we've done a brief overview of what the False Claim Act, anti-kickback statute, and the Stark Law is, we're going to talk about some consequences. Not following regulations regarding these statutes can lead to non-payment of claims, exclusions from all federal healthcare programs, loss of our licenses, criminal and civil liabilities that can result in fines, potentially imprisonment also, or both. Corporate integrity agreements between ViaQuest and the OIG, which stands for Office and Inspector General. So, why does compliance matter? Like I stated in the beginning, it could affect the company's reputation. It could affect the wonderful services that you guys are providing. So now we're going to look at some examples that you can Google yourself, and as it has to be public knowledge when people violate regulations. So here's a couple examples here. Excuse me. So a Tennessee-based imaging company paid $3 million in penalties and was placed on a corrective action plan when it was discovered that a network server was accessible on the internet, exposing PHI and ePHI, electronic protective health information, on over 300 million individuals, violating HIPAA privacy and security regulations. A healthcare network paid almost $1 million to settle a False Claim Act case related to billing for services performed by the cardiologist that were not medically necessary and were not supported by documentation. And then another example here is a pharmaceutical provider paid $392 million to settle a False Claim Act alleging they violated the anti-kickback statute by providing financial incentives to specialty pharmacies for promoting their drugs. Okay, so generally these fines are pretty high, as you can see here, and could cost the company money. And like I said, they have to publicly state what they did and then how much they have to pay on those violations. So the next thing we're going to get into is what is a conflict of interest. In summary, any circumstances where personal, professional, financial, or other private interests of a person compromise or biases, or the perception of the compromise or bias that exercises professional judgment and obligations. So it's really important that we make sure that we know that a lot of people potentially has outside positions, trying to work in multiple different places, but each company does have to have their own conflict of interest form. And in the next couple of slides, we're going to review our conflict of interest form. This is something that we have all staff members complete upon hire annually. And then each business line leader or designated person will review to see if there's any potential conflict of interest, where we need to ensure and review next steps on resolving any conflict of issues, or ensure that the services you're providing here at ViaQuest is not going to affect your other potential activities. So let's get into what the conflict of interest form is and looks like. Okay, so it doesn't look exactly like this because it is the PowerPoint here, but there is going to be different sections for you to be able to answer yes or no if there's any concerns of conflict of interest. So the first section of the form is outside activities and or employment. So the question will ask, do you or any immediate family members hold a position as officer, director, trustee, board member, partner, or key employee from a business outside of the company which provides goods and services or facilities in the company, or secures or may secure services from the company, or competes with the company either directly or indirectly by providing the same services as the company. The next one is outside financial interest, and the question asks, do you or any immediate family members receive profits or direct income from businesses outside the company which Same three items here. Provide goods and services or facilities to the company, secures or may secure services from the company, or competes with the company either directly or indirectly by providing the same services. And just as a reminder, immediate family could mean parents, spouses, children, and siblings, according to the IRS. So those four items, parents, spouses, children, and siblings, is considered immediate family there. Okay. Then the next one is outside ownership interest. Do you or any immediate family members own a financial interest in a business outside of the company, which, same three items, provides goods or services or facilities to the company, secures or may secure services from the company, or competes with the company either directly or indirectly by providing the same services as the company? Then the next section is going to be about gifts, favors, services, entertainment, and loans. So the question states, have you or any immediate family member accepts gifts, favors, services, entertainment, or loans other than those that have been both unsolicited and has a value of $15 per item or a total of $75 per item for the year, which might affect or influence your judgment or actions concerning company business? Yes or no? Next section is inside inside information. Have you or any immediate family members used or disclosed information related to the company for your own personal profits or advantage of personal profits or advantage of immediate family member? Yes or no? Direct knowledge. Do you or any immediate family members have direct knowledge of a company director, officer, physician, non-physician, employee, or contractor who has or might have authorized or commits an act which could or might be prohibited or illegal? Then the last two items of the conflict of interest form is family employment. Are any family members of your immediate family employed by the company or have a contract with the company? And then others, other than what has already been listed, do you or any immediate family members has any other relationships that may present an actual or potential conflict of interest with your employment at the company? So at the end of this training module here, you should be able to answer all these questions, and this will be submitted to HR and to the business line leaders, and potentially may be reviewed. If there is anything that you potentially mark yes, to ensure that we are addressing any conflict of interest issues. All right, let's get into the next section of our training here, which is about HIPAA and PHI. So I know a lot of people ask this, and I know people spell it differently, HIPPA or HIPAA. This is the correct way to spell it. It stands for Health Insurance Portability and Accountability Act. There is going to be two components or two parts of the regulation. There is going to be a privacy section and a security section. So the privacy is protecting verbal, written, or paper PHI, while the security part is regarding the electronic part of any type of PHI. Okay. So PHI is protected health information, and the E before the PHI is electronic protective health information. And they both can be identified as past, present, and future physical or mental health conditions, healthcare services provided to the individual, and the past, present, and future payment for healthcare services provided to the individual. So this next slide here is an example of the most common individual identifiers that you probably would be using more than any of them. So there are a couple more that I didn't list here, but these are probably the most common ones that you guys would probably use. And so these are things that we have to protect of our individuals. And we're going to get into more details of that as we go through the training. So the name, date of birth, social security number, phone number, fax number of the individual, home address and email address, the individual's patient ID number or medical record number, health plan beneficiary number, certifications, license, or bank number, biometric identifiers. That could be finger, voice, retina, okay, or face, full face photography, taking a picture of a client. Those are some common examples of PHI. So, next question. Who is responsible for confidentiality? If you don't know, it's everyone, same as before. So regardless of your position at ViaQuest, everyone that works for ViaQuest is responsible for confidentiality. Once again, ViaQuest has legal and ethical responsibilities to safeguard the privacy and security of PHI of all our individuals. So the next couple slides, we're going to get into ViaQuest's confidentiality agreement. This is also another form that all employees reviews and signs off on annually. We're going to take a moment and go through each one of these items to making sure that you understand each section here, okay? So the first one is, I agree not to disclose PHI to outsiders, including family and friends, or to other individuals served, or to other employees who do not have a need to know such information except in the course of fulfilling their job duties. So really ensuring that if we're not disclosing to anybody, especially if they do not have a release of information, for us to disclose that information. And even our coworkers who's not working with that client, unless you're doing some type of supervision or consultation and asking for consultation, there should really not be any conversations. And you still want to be mindful of not providing PHI. So you can still talk about a case consultation without even providing the names or identifiers of that person. Number two, access to PHI without a business need in order to perform your job duties is a violation of this agreement. So accessing another client's file or accessing anything because you can is a violation there. You only need to access items that is going to help you complete your job duties. Number three, I understand that I may not access my own PHI that may be maintained by the company. I will follow the normal process of requesting my personal PHI by signing an authorization to request information. So if you are trying to access your files with HR, or even HR trying to access their own folders, you need to make sure that you're authorized to request that. You need to do that authorization to request information, and you should not be accessing your own PHI. Number four, I agree not to discuss PHI where others may overhear the conversation. So hallways, elevators, break rooms, public transportation, even if the individual's name is not used. So this is a really common one. It's just so easy to be like, hey, Gabby, I want to talk about you about XYZ. Make sure you're saying, hey, Gabby, I need to talk to you about something, and I would like to do it in the office, or in an enclosed area, and not have it in the open. You never know who may be passing by. You never know who's listening in. And you always want to ensure, even if you're in one of the client's home and there's multiple clients there, please have those conversations in a closed area away from them. I agree to complete all required trainings and education related to the privacy and security of PHI. Thank you so much for being here. This is one of them. Number six is, if I have been given permission to remotely access PHI, I understand that I am responsible for ensuring the privacy and security of this information at any remote location, the same as I would as a company location. So even if you are working remote, you're at a home, you're at a day services, you're in anywhere, right? If you are on the clock and if you're working, you still need to maintain the confidentiality of our clients' information, or our individuals' information at all times. Number seven, I acknowledge that I'm responsible for every action that occurs under my username and password while accessing the company electronic systems, including EHRs, electronic health record. Accordingly, I will not willingly provide my username and password to another person to use or use another person's username and password instead of my own. So you are 100% responsible for anything that happens under your username and password. We should not be sharing username or passwords. We should not be letting other people utilize your account and or using somebody else's account. Number 8, I agree not to make any unauthorized transmissions, inquires, modifications, or purge of data, PHI, to or from a company electronic system or network. Such unauthorized transmissions include, but not limited to, removing and or transferring data from the company's electronic or computer systems to an unauthorized location or device. So everything that you do on our ViaQuest network and items needs to stay there and should not be transferred to your personal emails or computers or things like that. Number 9, I will not store PHI on an unencrypted mobile device or a mobile device that I am not certain is encrypted. So your personal phones, unless it is encrypted, you should not have PHI. And we're going to get into some common examples that people may not be aware of. We're going to get into that here in a little bit. Number 10, I will not send PHI to an unencrypted mobile device or a mobile device I am not certain is encrypted. So that's what we have secured email for, which we're going to get into a little bit later. And we're going to get into some examples of that later also. So number 11, I agree to log out of computer workstations, electronic systems, and or the network prior to leaving unattended for any length of time. Okay, so going to the bathroom, going to lunch, going to the printer, especially if you're in a place where there's other people there, or if you're working remotely, maybe be even working from home, you need to make sure that nobody else can access your information, even if it's just for a moment. So logging out of your EHR, closing down your laptop, putting it in sleep mode for that a little bit of time that you're away from your devices. I will not post, discuss PHI or images of individuals served on social media sites. Posting of images on company-sponsored social media sites requires authorization of the individual served or their legal representative and must be accordance to the company policy. So we're going to get into that policy a little bit later, but this is very important, especially as we get into social media day and age. Following our policy procedures about that is going to be very important there. 13, I acknowledge and agree that I do not have an expectation of privacy when using or accessing the company's electronic systems or network. The company has the ability to track and monitor my access to PHI, and I understand that my access may be audited at any time. I also understand that my access may be limited or revoked at any time. And we're going to get into that also a little bit later, making sure that we're utilizing things that we need. And then the last item of the confidentiality agreement is upon termination of my employment or work at the company, I will not disclose PHI, nor will I take any such information with me. I will return all documents, papers, records, key fobs, passwords, disk, devices, equipments, etc. Any other materials in my possession or under my control that is the company's property or may be directly indirectly related to PHI maintained by the company. Okay, so if you choose to ever leave ViaQuest, we hope that you don't, and we hope that you love your job here at ViaQuest. But we will need that information and all items back upon you leaving us. Okay. All right, so that is the confidentiality agreement. That is another form that you will sign off on of a training that you received today. We do that every year to making sure that we're maintaining confidentiality. Okay, now we're going to get into the minimum necessity standards. Okay, so accessing PHI or ePHI is on a need-to-know basis. The only PHI that you are allowed to access is for individuals you're involving with while providing services. Employees are not permitted to access their own PHI at any time. Like I said earlier, you'll have to do a request form to do that. And the PHI or EPHI of their spouses, children, or other family members or friends, unless directly involved in their care services. So even if you know that they're receiving maybe a different service from a different business line or something like that, unless you're on that release of information or unless you're provider of that care or guardian or something like that, you will not be freely be given information about that. The compliance program will conduct audits periodically to determine appropriate amount of access and providing recommendations and education according to policy procedures. So once again, you will only have access to PHI on a need-to-know basis to perform your duties. Don't request more PHI or EPHI than it's necessary. So for example, don't request the whole chart. If you only need to look at the assessment or the event that happened 2 weeks ago, then that is the only thing that you're going to request. And also on the opposite side of that, don't give out more information, PHI or EPHI, than is necessary. If someone sends you a release of information and says, hey, I need to look at all documentation from this date to this date, you're not going to send the whole chart. You're only going to send information according to what is on that information, release of information. All right, so now we're going to get into payments, treatments, and operations. So there are 3 situations in which PHI can be shared without an authorization that is not in violation of HIPAA. Those 3 are payments, treatment, and operations. So payments is information can be shared to payers when we're billing for services. Treatment means information that can be shared between healthcare providers who are treating the same individual. And then operations. Information can be shared for healthcare operations of the organizations. So those are things like activities related to quality, monitoring, compliance, and legal. So those are the 3 acceptable items where we don't need a release of information and it's authorized for us. It doesn't violate HIPAA. So now we're going to get into the Notice of Privacy Practices. So that stands for NPP. If you've heard that before, we want to make sure that we're following the NPP. This is for individuals that we serve. It is our duty to inform clients and individuals or patients regarding the Notice of Privacy Practices, on how their PHI or EPHI will be used and disclosed by ViaQuest and their rights regarding their PHI or EPHI. So we're going to go through the whole Notice of Privacy Practices also here today. We want to ensure that you're able to educate your individuals and clients when you're reviewing this document with them. So you should be reviewing it with them. Most business lines, some have some type of client handbook or admission packet that has this embedded in it. And minimally, we should be reviewing it with them upon mission and annually. Okay. I'm getting ahead of myself here. So ViaQuest, we also ensure that we want to be accessible to the Notice of Privacy Practices. And so we're going to post them in all of our office locations. Like I said, it's going to be your job, all of our jobs, to communicate the NPP to our individuals served. Like I said, done usually in the mission packet there. And it's required for us to review with them on an ongoing basis. And our consent form, we're going to obtain acknowledgement of the receipt of the NPP. And like I said, we should be reviewing it annually. This is also posted on our website too, so they can access that at any time. All right, so let's get into it. Notice of Privacy Practices, your rights. When it comes to your health information, you have certain rights. This section explains your rights and some of our responsibilities to help you. So get a paper electronic copy. You can ask to see or get a paper or electronic of your medical records or other health information we have about you. Ask us how to do this. And so it would be you be able to explain whether if it's going through the medical records or going through your management on how they can access that. We'll provide a copy or a summary of your health information within 30 days of request. We may charge you a reasonable cost-based fee, and that will be determined by the management or the medical records department on if there is any cost to that. Ask us to correct your medical records. You can ask us to correct your health information about you that you think is incorrect or incomplete. You may complete a form explaining your request. Ask us how to do this. We may also say no to your request, but we'll tell you why in writing within 60 days. And so there's a specific form that we're going to go over all these forms after we read the NPP here. The next section of it, request confidential communications. You can identify how you would like us to contact you with confidential information. We'll accommodate all reasonable requests. Ask us to limit what we use to share. You can ask us not to use or share certain health information for treatment, payment, or other operations. We do not require to agree to your request, and we may say no if it would affect your care. If you pay for a service or healthcare item out of pocket in full, you can ask us not to share that information for the purpose of payment of our operations with your health insurer. We will say yes unless a law requires us to share that information. Next section is getting a list of those with whom we're sharing information. You can ask for a list or accounting of the times we're sharing your health information for 6 years prior to the date you ask, who we share it with and why. We will include all disclosures except for those about treatment, payment, and healthcare operations, and certain other disclosures, such as any you asked us to make. We will provide one accounting a year for free, but we'll charge a reasonable cost-based fee if you ask for additional ones within 12 months. And then get a copy of the privacy practice. You can ask for a paper copy of this notice at any time. Like I said, it's also posted on our website if it's needed. Choose someone to act for you. If you have given someone medical power of attorney, or if someone is your legal guardian, that person can exercise your rights and make choices about your health information. We will make sure the person has this authority and can act for you before we take any actions. Filing a complaint if you feel your rights have been violated. You can file a complaint if you feel we have violated your rights by calling the third-party compliance hotline, going online to the compliance hotline website, and there's the website, and they'll be printed for them to have, or email the compliance officer directly. And they also can send a letter to the U.S. Department of Health and Human Services for civil rights or visit their website there. So that is all going to be posted in the NPP. Then the next section is your choice. For certain health information, you can give us your choice about what we share. If you have a clear preference for how we share your information in the situations described below, tell us what you want us to do, and we will follow your instructions. So in these cases, you have both the right and choice to tell us to share information with your family, close friends, or others involved in your care, share information in a disaster relief situation. If you're not able to tell us your preferences, for example, if you are unconscious, you may share your information when we believe it is best for your best interest. We may also share your information when needing to lessen a serious or imminent threat to health and safety. In these cases, we never share your information unless you give us written permission. So, marketing purposes, sales of your information, most sharing of psychotherapy notes, and there's other regulations about that. In the case of fundraising, we may contact you for fundraising efforts, but you can tell us not to contact you again. The next section is the use of our use and disclosures. We are allowed or required to share your information to treat you, to run our organization and to bill for the services you receive. We can also share your information in ways that contribute to the public good, such as public health and research. We have to meet many conditions in the law before we can share your information for these purposes. So one is treatment. We can use your health information and share it with other professionals who are treating you. So an example is a doctor treating you for an injury, ask another doctor about your overall health conditions. To run our organization, we can use and share your health information to run our organization, improve your care, and contact you when necessary. An example of this is we use health information about you to manage your treatment and services. The next section is going to be about billing for services. We can use and share your health information to bill and get payments from healthcare plans or other entities. An example of this is we give information about you to your healthcare insurance plan, so it will pay for the services. Help with public health and safety issues. We can share information about you for certain situations, such as preventing disease, helping with product recalls, reducing adverse reactions to medications, reporting suspected abuse, neglect, or domestic violence, and preventing or reducing a serious threat to anyone's health and safety. The next section here, research. So we can use or share information for health research with proper authorization, and we always going to comply with the law. We will share information about you if state or federal laws require it, including with the Department of Health and Human Services, if they want to see that we're complying with the federal privacy laws. Respond to organ and tissue donation requests. We can share health information about you with organ procedure organizations. And then work with a coroner, medical examiner, or funeral director. We may use or share health information with the coroner, medical examiner, or funeral director when an individual dies. Next section here, we can use your health information about you when we're addressing workers' compensation, law enforcement, or other governmental requests. So any type of workman comp claims, law enforcement purposes, law enforcement official items, with health oversight agencies for activities authorized by law, for special government functions such as military, national security, and presidential protective services. We respond to lawsuits or legal actions. So ViaQuest will respond to a court order, an administration order, or in response to a subpoena. Our responsibilities, the last section of the NPP. We are required by law to maintain the privacy and security of your protective health information. We will let you know promptly if a breach occurs that may have compromised the privacy or security of their information. We must follow the duties and privacy practices described in this notice and give you a copy. We will not use or share your information other than as described here unless you tell us we can in writing. If you tell us we can, you may change your mind at any time. Let us know in writing if you wish to make any changes. So changes to the terms of this notice, we can change the term of this notice and the changes will apply to all information we have about you. The new notice will be available upon request in our offices or on our website. So I wanted to read it to you guys to making sure that these are things that you should be reading to your clients when you're talking about how we're protecting their clients' rights. Like I said, it's going to be in your mission booklet or it's going to be in your client handbook that you're reviewing on a regular basis, at least annually or upon request. So now we're going to get into individuals' rights regarding their PHI or EPHI. Individuals have the right to request to amend their PHI, and this is where I talked about earlier all the forms that would potentially be used if they would like to make any changes. So the first one is amendment of PHI information. The second one is the request for accounting to disclose information. And that's if they want a list of accounts of all their PHI or any disclosures that we may have made. The next one is request for restrictions to the PHI. So if they would like to restrict on how ViaQuest uses and discloses their health information, they're going to utilize that form. And then the standard authorization, or the most common one that you guys are probably aware of, is this one, or ROI. This is to obtain a copy of their health information created by ViaQuest in any format. And then admission consent form, and this is how we communicate their health information for them that will be addressed. So in the admission consent form, we consent for treatment to bill for services, making sure that we review the notice of privacy practices there. All these forms can be found on Paycor at any time. So, did you know 80% of all HIPAA violations occur because employees did not follow policy procedure? And so we want to make sure that we are following all security items, and there's going to be 3 different components here. So the first one is administrative safeguards. This includes making sure that we have strong passwords on our work devices or our personal devices that we use work for, or all of our electronic devices. Making sure that we have secure workstations. And then making sure that we're following the release of information regarding PHI. Physical safeguards, security systems. So all of our items that RT provides to us has security systems on them. We want to make sure that we are not affecting or utilize anything that can harm that. If we're having paper files or anything like that, we're locking the doors and cabinets in the homes or at the offices. We want to make sure that we're doing that. And then technical safeguards. Once again, IT will ensure that we have firewalls and encryptions on all things. Now we're going to get into each individual most common items to ensure that we are making sure that we are having privacy and security practices safeguards. So the first one is conversations. It is so easy to start a conversation with a coworker while you're passing them, or, hey, Gabby, I need to talk to you about XYZ. We always need to be mindful in making sure that we are not discussing client information in public areas. These need to be done behind closed doors and private areas. If it is, and this is very minimally, it needs to be in public areas, you need to make sure that you're not disclosing PHI and potentially talking in code, right? To ensure the safety of the client's PHI. Next, we're going to get into texting. Oh my gosh. So this is so common nowadays to be texting people. And this is one of the main ways that we're communicating with each other, which can be great for coordination to ensure shifts are covered, asking someone to call you back to resolve on a pressing issue. But we should be refraining from sharing any type of client information while we're texting. Regular texting from phone to phone is not a secured platform. Absolutely no client information should be shared. If there is something pressing, text them and say, hey, can you please call me back? Or I sent you this really pressing email. Can you respond ASAP? Now, there are company approved platforms where we can disclose PHI. The most common one that ViaQuest has is Microsoft Teams. And that is something that ViaQuest allows you to download on your personal device or your work device. That is a secured platform for you to share PHI. It is kind of like a texting platform where it's kind of like a message where you can text, right? But it allows for secure, making sure that we're providing it on a secure platform. So that is my suggestion, is you can make group chats on there, you can do individual chats, and text on Teams there. As we go into more technology based at our work, we may have less and less paper, which is fine. But if we do have paper and it has client information on it, we need to be mindful and ensure that we're keeping it in a secured areas. It should not be laying on counters or areas where people can access it. All charts should be kept in behind locked doors or locked cabinets and should not be out for everyone to see. Even in the homes or at a facility or whatever your main location of work is, we need to ensure paper documents are in secured areas. Okay. We're going to get into shredding now. So if you have any paper documents of individual or clients that you may no longer need, so maybe you're done with it, but it has pH on it, please do not, please do not put it in the trash can. It needs to go into some type of shred bin, a secured bin, or I know some places have the crisscross shredder. You need to put it in those designated areas to dispose of. This will increase our efforts to secure our individuals and clients' patients' information. Okay. All right, so now we're going to get into password safety. You never want to share your username and password with anybody. Only you should have access to it, and never let anybody work under your username and password. So we talked about this earlier. Like I said, you are responsible for everything that happens underneath your username and password. Never write down your password where someone can find it. Please do not put it on your laptop, on the back of your laptop, on your computer bag. Please try to remember your password and not write it down at all. Never post your password on or near your computer. Don't use the same password for every system. So the same password for Paycor and Certify and your EHR and your computer should all be different. Do create a complex passwords utilizing characters, numbers, uppercase, lowercase, all those lovely fancy good stuff. Make it difficult. Don't make it very easy. Don't do your last name and one, right? So do something very easy. Don't do something that is easy. Do something that is hard. Let's get into email. This is a lot of the stuff is reinforcement of what we did already. So send work-related communication information on individual served via the ViaQuest email only. PHI or PHI send outside of ViaQuest network must be encrypted by putting secure in the subject line of the email. And I'm going to show you what that looks like on the next slide if you don't understand what that means. Don't email PHI from your work email to your personal email and vice versa. Don't use ViaQuest email for personal reasons or personal accounts. And then last is don't use public non-secure web terminals to access ViaQuest systems or emails. Those free web terminals could potentially be harmful, and allows is kind of like a gateway into the system here. So please be mindful of utilizing those items. So this is what I mean when I say sending a secure email. In the subject line of the email, so where you put, please review this, or MUI, or something like that, it needs to be in all caps. So as you see here, SECURE with the semicolons, that needs to be at the beginning of every email. This is what prompts it to be HIPAA compliant, okay? So whether if you're sending incident reports or saying who you saw today, in the body of the email or any attachments, if they do not have an at viaquestinc.com after their name, you have to send it secured. So please start to get that practice if you haven't already. Internet. The internet is not private nor secure, so please be mindful that access to the internet on the ViaQuest network for business purposes only. Internet activities occurred on ViaQuest networks are monitored by our IT department for safety reasons, and inappropriate use of internet can result potentially into a performance coaching. So if you need to Google something for personally, please use your personal devices or your personal computers. The next thing we're going to get into is social media. We kind of already touched on this a lot earlier, but we want to make sure that we're never posting information about individuals served on social media. Only our social media or marketing manager is allowed to do any type of posting. So we're never going to be posting on social media platforms associated with work-related information, especially about individuals. And if you are doing something with a coworker, please make sure you're getting their permissions before posting anything. The right to express oneself on social media doesn't mean freedom from consequences. So please be mindful if you're in a work function or if you're posting with a coworker that it is still professional and responsible. All employees are responsible and accountable for social media communications that could impact ViaQuest or individuals that we serve. Written consent is required before photos, images, and or videos of an individual is taken. So that is going to be our social media policy. Those are just very highlight key points from that. But once again, if you are taking photos, those need to be in a secured platform or any of that stuff. We have to have written consent. So it needs to be in their chart for us to be able to do that. And it needs to be approved and sent to the marketing manager to post on ViaQuest social media only. Okay, links, URL, suspicious emails. So cyber criminal uses emails, links, URLs all the time, trying to steal information. So please, please, please do not open suspicious, unexpected emails or emails from addresses that you do not recognize. Don't even click the unsubscribe button, as sometimes they could have links that could also be harmful. If you're not sure about an email, contact IT and they will let you know. I contact them all the time. If something looks weird, or if someone just sends me a document, I'd be like, hey, IT, please look at this and let me know if I can open this or not. So please don't be afraid to reach out to them. We want to make sure that we are not harming your computers and or harming our network that has PHI. So phishing scams, and this is an example just to help you kind of safeguard yourself on when you're looking at emails. Please be mindful of how emails are looking because sometimes they can look real. So be mindful of fake email addresses, improper spelling or grammar like this, hyperlinks that different from the ones shown or hovered over the link. So this one potentially is bad from this one. Requesting the personal information, anything required immediate action, that is always a good key indicator. Free gifts, one of a prize or contest, requesting donations, include a suspicious attachment. Please do not open that attachment. If you suspect you have received a phishing email, please don't open it. Either delete it or forward it to IT or to contact IT saying that you received this email, because other people may also receive that email and IT could help delete that and continually safeguard our items there. Electronic media and mobile devices, so phones. Please don't purchase or use personal mobile devices just to store PHI. There's no reason to do that. All of our computers and all of our ViaQuest equipment has the adequate storage to do that. If you need more, please contact IT and they'll be able to get that extensions for you. Cell phone use for work-related communication should be password protected with screen locked and encryptions. Don't install, remove, or download software on any ViaQuest electronic devices. If you need anything downloaded, please call IT and they will ensure that it's done in a secured manner. Call IT help desk before returning electronic medias to a vendor or before disposal. PHI or ePHI must be removed from all devices, including cell phone, copiers, fax machines, etc. So if you do have the ViaQuest email on your personal phone, please call them. They can make sure it's wiped and cleaned out before they turn it in so other people won't be able to access it. In addition, once again, public Wi-Fi is not often a secured place. So please don't leave your laptop in your car or your vehicle in general, any ViaQuest equipment. You must, if you are going from potentially one site to another and one home to another, and you do have that, please put it in before you leave. Don't do it when you get to your destination. We never know who's watching you, so you need to make sure if you're going from one site to another, you're not going to be needing it. Please put it in a secured area, but it needs to make sure that it's not visible. Okay. You want to close all your windows and lock your car. Please lock your car. Do not leave it unlocked. And you are not able to leave it in your car overnight. So every single day, you need to make sure that you're bringing your laptop in the home, and don't even leave it in your locked garage. It needs to be in the actual home. Or you could just leave it in the office if you were working at the office. Do not leave your laptop or tablet or your phone unattended in public areas. Be aware of the visibility of your computer screen when others are around. So even if you're working in a public area, try to have the wall against you, not being out in the open for other people to see what you're working on behind you when you're dealing with PHI. Protect laptops and tablets from extreme temperatures and food and drink spills. So making sure that when you're having lunch, if you're having lunch at your computer, not having your water being so close to where to spill over, or food that can fall on your items, to reduce potentially breaking it. Don't use ViaQuest issue laptops or tablets for personal use, and immediately report the theft of any ViaQuest issue laptops or cell phones to your management and the IT department as soon as possible. Printers. Don't leave PHI on printers. Remove your prints as soon as possible. Check what you're taking off the printer to make sure it's yours. My recommendation is print secured. And if you don't know how to do this, please contact IT. They can help you with this. But if you are printing a bunch of documents, or if you are needing to print something, you want to print it now, but you don't feel like going out there, please print it secure. So when you get to the printer, you can print in your code, and then you can ensure that all your items are being printed and you are picking up your prints. We don't want to leave PHI on the printer because anybody has access to that, right? And then faxes. We don't, fax machines should be accessible, shouldn't be accessible, excuse me, to individuals or visitors. Remove paperwork from the fax machine as soon as possible. Always use a fax cover sheet if you're using fax. Double check the fax number before you hit send, and then contact the compliance officer if you send a fax in error, or if you are notified a fax was going to an unattended recipient. Okay. Computers and the screen. So once again, just to reinforce this, we need to make sure that we're logging off for all breaks. And at the end of each day, you need to lock your screen and log off anytime that you're away from your computer, and position screens away from visibilities by non-employees or using the protective screens. Hardware and software, never disable antivirus applications, password, protective screens, configurations, etc. Please do not do that. Flash drives or CDs from outside ViaQuest. These items can contain a virus which can affect our network. If you are given any of these items, please contact IT to verify that it's okay before you use it. So why is this important? Here are some examples of violations of PHI. So a common one was target database. Credit card data affected 80 million people and cost the company over $148 million to address this issue. Another health plan was fined over $1.2 million for failing to properly erase information of a whole bunch of clients on a photocopy hard drive. Phoenix Cardiac Surgery paid $1 million for breaching of a text message. Adult and pediatric dermatologist of Massachusetts paid $150 million fine for theft of an unencrypted thumb drive containing information of 2,200 patients. All right, we're in the home stretch. So I want to make sure that you know how to report things appropriately, and then what does that mean? So as I said earlier, everyone, regardless of your position, is responsible for reporting known or suspected privacy and security issues and compliance concerns. Report concerns as soon as you suspect them. Please do not wait or want to see how things develop. That is what part of the investigation is for. Please do not do the investigation on your own. Please make sure you're reporting it to the compliance program as soon as you can. Please provide as much information as you can when reporting a concern. All the details is really great for us to make sure that we are doing things appropriately. Don't allow anyone to prevent or intimidate you from reporting a concern. And then also, if that is the case, please also provide that information so we can address and re-educate that person. Don't lie or mislead the individual conducting the investigation. Excuse me. Please be truthful as much as you can. Please don't add things or make it seem worse than what it is. We just need all the facts so we can address it appropriately. Don't hide or alter, or destroy, or withhold documents such subjects to an investigation. Don't speak to investigator auditors before speaking to a supervisor or manager. Most privacy and security violations are accidental, and people who make such an error rarely make another one. However, ViaQuest is obligated by law to report confirmed HIPAA violations to the client individual served and the Department of Health and Human Services and Office of Civil Rights. So it's important that incidents are reported, okay? Failure to report a known or suspected issue can have negative consequences for individuals and ViaQuest. So please, please, please report. All reported issues are reviewed by the compliance officer to determine if they are compliance or not compliance related. Issues not compliance related will most likely go to HR or the appropriate department to address that issue or concern. Reporting issues are reviewed and assessed for investigation and further review actions. So depending on the report, investigations may incur, and that could be anything from doing inspections, documentation review, interviews, anything that we need to ensure that we're properly investigating. The reported incident may also lead us to do some monitoring auditing, making sure that people are following policies and procedures and working with HR on any type of performance improvements and or coachings. Some responses to the compliance hotline may require additional information to investigate. If you call the incident hotline, they'll give you a callback number and they'll give you a case number also. If additional information is asked for, or if you want to know the follow-up of the incident, you can call that number back. And sometimes they may ask for additional information, and at that time, we would ask you to provide that information so we can further investigate the issue. When in doubt, please report. Ask questions or report concerns safety anonymously. So ViaQuest does have a third-party independent organization called Ethical that allows 24/7. So regardless if it's a holiday or not, you can call them day or night, okay? This is their number. It is posted in all of our offices. There's multiple ways to reach out them. As you can see here, there's an 800 number. You can go to their website, mycompliancereport.com. The company code is QVI, or to the actual direct website is there. You can scan this QR code and it will also take you to the website to do a complaint. Or if you'd like to contact the compliance officer directly, we do have an email for that. So that's compliance@viaquestinc.com. That is monitored, and we hope to do responses within 48 hours. Okay. Last but not least, it all begins with you. Please don't be concerned of violations or retaliations. Please, please, please report anything. Compliance begins with you, and everybody is part of the compliance program, and the compliance team needs your help. So please feel free to reach out to us anytime. Thank you so much for spending this time with me today and learning about the compliance program. I hope you have a great day, and we will see you around.